أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Today is the day that we all celebrate. Today is the International Day of Girl Child. I would like to congratulate the girl child everywhere around the world. Girls are heroes. Girls are my heroes. Girls are your heroes. Girls are the world heroes. Why they are girls heroes? We all know that because they are a great change maker. They change the world. They face all kinds of problems around the world. They face discrimination. They face education, lack of education. They face healthcare system. They face child abuse. They face child marriage, but they are not afraid. You know, and I know, that girls are fighters. They never stop fighting. They are always fighting for the goodness of human soul. Girls never give up. They never give up. Why they don't give up? Because they are determined to bring the change, transformation. And that's the reason today we all celebrate the International Days of Girl Child. They are not scared. They do not want anybody to rescue them. They fight. They fight, and they continuously to fight to bring the change in this world. I am so proud of MCN, Millennium Campus Network. Every one of you are so powerful. Every one of you are a change maker. MCN proved to the world that connecting people from all over the world and bringing the change. And I am so grateful to be part of this community. Girls are changing community. They are changing their family. They are changing their nation. They are bringing change for better world. We all know today world is what a mess we are living in. And if we do not give opportunity to the half of the population around the world, what we will face? We will face disaster. And you know that girls are more powerful than boys. I am sorry. I am sorry to say that, but today there was somebody come and ask me, talk to me about it. You know, in our school, you know, Afghan Institute of Learning, working with lots of girls, for hundreds of girls, millions of girls. Every grade that we look, we see a huge jump for girls' education. They do better in school, they do better in their health work, they do better in life skill, they do better in income generation, they do better in business, they do better in ethics and responsibility, they do better in leadership, they do better in entrepreneurship. These are all areas that through statistics, through the work that we do with Afghan Institute of Learning, we have been working for 20 years. Through these 20 years, I could keep seeing that the girls start from zero and they are jumping just tremendously. So we are proud of our girls. Our girls are heroes, and I want to every one of you say that girls are heroes. Louder. Louder. And you say all, congratulations for the days, International Days of Girl Child.
I'm Ryan Lewis. I'm a music producer and a film director. As you can see, the past couple of years of my life have been absolutely crazy. everything I knew of life completely changed in an instant. I worked for years on an album with Macklemore that would take us far beyond what we ever imagined. Before I knew it, we were constantly traveling. We played roughly 300 shows in a single year. We heard songs that we made in our parents' basements played on every radio station in the country. We walked on red carpets and did hundreds of interviews. Our music had exploded into the world. But that is my music story. That's a story you may have already heard. So let's rewind. What a lot of people don't know about me is my life before Macklemore and Ryan Lewis. A huge part of what's made me who I am is something I haven't talked about in interviews. If I could steal just a few minutes of your time, I'd love to tell you about the strongest woman that I know, my mom, Julie Lewis. In 1984, my mom gave birth to my oldest sister, Teresa. In Washington State, this was 1 year before anyone was testing for the HIV/AIDS virus in blood donations. After giving birth, my mom ended up needing a blood transfusion, and without anyone knowing it in that moment, had HIV-positive blood put into her body. At age 25, 1 year younger than I am right now, her life would change forever.
For years, my mom had no idea that she had HIV. She gave birth to my sister Laura and my brother Ryan and just continued living her life. She started to feel unusually sick and went to the doctor multiple times and was finally diagnosed as HIV positive, and in turn was given only a few years to live.
My brother and I were not born with HIV. We both had a 25% chance of being born HIV positive, but we weren't. We were both extremely lucky.
My name is Julie Lewis, and I'm HIV positive. I was infected with HIV 30 years ago. And I never thought I would be sitting here 30 years later talking to you. I was diagnosed HIV positive in the summer of 1990. I was 32 years old, and I had 3 young children. They were 2, 4, and 6 years old. I had never thought about dying.
But you know what's amazing? My mom never died. She lived.
She never thought, and we never thought as a family, that she would be a 30-year survivor. So for her, coming up with this idea of how do we celebrate in a way that can have a positive impact in the lives of other women, girls, families around the world who didn't have the access to the kind of healthcare opportunities that she has had.
I want to do something big. The 30/30 Project is that big idea. We believe that healthcare is a human right. We have the knowledge and we have the treatments. Life-threatening diseases like HIV/AIDS can be managed. What people need is access.
In celebrating this 30-year mark, we want to provide just that, access to healthcare for those who need it the most. We want to build medical centers worldwide that will stand strong for at least 30 years. It's called the 30/30 Project. So how are we going to do this? First, we bring in Construction for Change to build the building. Construction for Change architects then draft a blueprint. A project manager is sent to the site. Local foremen and community workers are hired to build the structure. Local partners like Partners in Health fill the building with doctors, nurses, and healthcare specialists that begin working immediately. Suddenly, comprehensive healthcare, meaning healthcare that covers all illnesses, is available to the entire surrounding community of 20,000 people. The first destination is Malawi. Why? It's a no-brainer. Over 1 in 10 adults living in Malawi has HIV or AIDS. There's an immediate need for the exact type of medical center that we're talking about in the rural Nino district. Let's talk bigger picture. Imagine 30 of these medical centers popped up all over the world. What would that provide? Roughly 600,000 people would now have access to healthcare. With this amazing past year that I've had, I'm honored to be the first donor to the 3030 Project. I'm asking you to join me. Join my family's story. See how far we can take this. Malawi is only the beginning. There are so many locations in need of medical centers just like these ones.
I've known Julie and the Lewis family for years now, and have always found inspiration behind their family's incredible story. Ryan, myself, and the whole team are stepping up in full support of the 3030 Project. Below, you'll see a wide variety of perks for donating. From t-shirts to sign posters, we want to ensure that this project comes to life. You'll see that the 3030 t-shirt reads, "Healthcare is a human right." That is what we believe. We want to see this idea put into action. Any amount that you can donate goes directly to building healthcare centers worldwide.
Now we are going to present this MCC Award, Global Generation Award, to Julia Lewis.
Well, good evening, and first of all, thank you so much for this award. To be honest, I've never received an award like this before, so I am grateful and I am honored to be amongst such an esteemed group of honorees. Tonight, because the theme is the Year of the Girl, I wanted to tell you a couple stories of women who have both encouraged me and inspired me. I was infected with HIV 30 years ago. 30 years is a long time, roughly 11,000 days, having now taken over 60,000 pills to stay alive. Trust me, 30 years is a very long time. Well, let me transport you back in time in my own personal time capsule to the 1990s, long before Macklemore and Ryan Lewis, long before Thrift Shop and Can't Hold Us and Same Love. I was just a mom with AIDS, having been given 3 to 5 years to live. I joined a speakers bureau of about 15 to 20 other people who were HIV positive. We spoke about HIV and AIDS to high schools, colleges, universities, drug treatment centers, professional trainings. Really, we went anywhere that would have us. I joined this speakers bureau for purely selfish reasons. You see, I had 3 small children, and I was gravely concerned that my own kids would suffer stigma and discrimination because of a disease that I had. I wanted the world to know that this was not a disease that was caught, it was acquired. There were definite ways to acquire it. You didn't need to acquire it, and you did not need to be afraid of the people who had it. Well, I was on that speakers bureau for 10 years, basically telling the same story of my life over and over and over again to literally thousands of people. Well, let's fast forward in time to now. Well, actually 2 months ago. I met a woman, it's up here, named Jenna Nardelia. She came to Seattle from Nashville to thank me. She said that in 2002, I came to Whitworth University and talked to her class. She said that my story and my co-speaker Bill's story was the seed, the spark, that led her to write a 26-page proposal to the band Jars of Clay, telling them why she should run a nonprofit for them focused on HIV and clean water access. Today, 10 years later, Jenna's nonprofit Bloodwater is in 5 countries, has 17 staff, and has raised $24 million for clean water and healthcare, HIV healthcare access in Africa. I had no idea that my somewhat messed up life and my feeble attempt to change the world and better the world by sharing my life story could have, and actually did have, this kind of ripple effect. Thank you, Jenna and Ardelia, for coming full circle and doing what most people don't do, telling me and encouraging me greatly and reminding me that even our smallest efforts can send out a ripple effect that goes much farther and longer than we ever imagined. When my family told me that they wanted to celebrate my 30 years of survival, I have to tell you I was somewhat reluctant. You see, of the 15 to 20 people who were on that speaker's bureau with me, almost all of them died. Joyce, Kara, Cami, Mark, Tony, George, Barry, Craig, they all died. It felt so wrong to celebrate when so many people I loved did not make it. I decided only if we could celebrate in a way that paid it forward, that did something good for someone else in honor of my friends who had died, only then would celebrating seem okay. Well, I was at a Construction for Change event at Microsoft, and one of our project managers, who had helped build a hospital in Haiti, was showing a slideshow. Now, my job at Construction for Change is to set up these building projects, and I had set this up to build this hospital, and for over a year, I was getting weekly updates about the building of it. Well, it wasn't until I saw these photos that I realized this hospital was actually mostly built by women. There they were, up on the wall, women in their long saris with tools in their hands and cement bags on their heads, building this hospital. Martha, our project manager, went on to explain that although CFC pays a fair wage, these women were not mainly motivated by money. These women were building a hospital because they were tired of their very own children dying in transport to the nearest medical facility, hours and hours away, many times only getting there to be turned away because they could not pay. These women will never know this, but they were actually the seed, the spark, my inspiration, the beginning of the idea of the 30/30 Project. I wanted to provide healthcare access to people who didn't have it, like these women in India. Because a person's health shouldn't be determined by where they live or how much money they have. I named it the 30/30 Project because I had lived 30 years and because Construction for Change builds buildings that they say will stand strong for 30 years. But here's the funny part of this whole story. My big idea was to raise enough money to build one healthcare center. I mean, they're not inexpensive, and I'm not completely healthy, so it seemed like a big plan. And then my son Ryan got involved, and he said, "Mom, I'm gonna make you a short film about the 30/30 Project. But Mom, you've lived 30 years, so I really think we ought to raise enough money to build 30 health care centers." There's a big difference between 1 and 30. The 30/30 Project was launched 6 months ago, And so far, we've raised enough money to build 5 medical facilities. We have 25 to go. All I can say is thank you, Ryan, for stretching me, for giving us a way bigger goal, one that literally wakes me up in the middle of the night and makes me very uncomfortable, but one that's so worth doing. You know, your theme for your video was, "This is my era." Well, in fact, this is your era. The baton of global care and equity is being passed, and it's being passed to you. This is your era. Your efforts will cause ripple effects that will go out much further and wider and longer than you ever imagined. So go and tell your stories and share your vision and share them over and over and over again until someone gets it. And then do something. Go write that 26-page proposal. Make that YouTube video. Advocate for someone whose voice needs to be heard. And finally, take that big idea of yours and times it by 30. This is your era. I look out at you and I am at peace, and I'm assured that our world is in good hands. Thank you.